So I'm CJ Spotswood. I'm a psychiatric nurse practitioner here in Maine. I've been a psychiatric nurse for over 20 years. I've been working as a nurse practitioner for 3. I am the chief psychiatric clinician for a company called Remap Therapeutics. I'm a graduate of the California Institute of Integral Studies and their certificate program for psychedelic therapies and research. I've done education with Psychedelics Today. I co-authored Psychedelic Dot Support's 10-hour psilocybin education program. I've published a couple journal articles, and I'm the author of the Microdosing Guidebook. So I'm going to talk to you guys today about microdosing and what it is. First off, I just want to mention that a little bit more of my background. Being a nurse, I come from practicing within what's called the biopsychosocial spiritual model, where I'm looking at all of those things when treating individuals, more than just their depression, their anxiety, whatever their mental health diagnosis is. In doing so, we're looking at the whole person. So, looking at the biology, the structure, the genetics, medications they may be on, what are they taking into their body diet-wise. Also looking at what is their psychological, what is their mental health, their self-esteem, their distress tolerance, coping skills. Looking at and working with them within their social network. What is their social circle, their family, their work, their job, what is their community. And for many people, the spiritual model, looking at their soul, religion, where's their place in the world, and what do they have maybe for a higher power or spiritual connection that they have. Some have reported having major significant shifts in their spiritual well-being after using high-dose psychedelic medicines. With that, some people who have been agnostic have had spiritual experiences that have changed all of their outlook on everything. The other thing I often times educate and talk with my patients about is looking at what I refer to as the 4 food groups or the 4 pillars of good mental health. That being diet, exercise, sleep, stress, anxiety management. We know if one of those 4 things start to topple over being a pillar, other things can go. Like if you don't have a good diet or good exercise, your sleep might be thrown off, your day might be thrown off by those types of things. And diet includes many things, things that we take into our body, not just the food that we eat, but what other things do we consume? Is it, social media? Is it going online and on computers or watching TV too late? What happens is there's an emission of the blue lights that come from it, which then affect our melatonin production, which then decreases the amount of sleep. So I think it's really important for us to kind of take a look at all of those things. As I mentioned earlier when I was speaking, that psychedelic medicines is not a new thing other than the indigenous use that has been used for thousands of years. But we also, in the 50s and 60s, we had large amounts of individuals, like 40,000 patients have used psychedelic medicines. During that time, there was also several dozen books that were published. There were 6 international conferences on psychedelics and therapy and what are we going to do with it. So it really was not a new thing. Also want to add that the current pharmacological treatment for psychiatric care are merely palliative attempts to address symptoms and reduce the experience of suffering. The medications that I literally prescribe every day do not cure, they just help us to cope in this world that we are in and how we are adjusted to that. When individuals start medications, what we have found, the research has shown that 30% have a better improvement if they are also doing a concurrent psychotherapy treatment with that. So it's not just taking a medication and hoping things to change. There's some work involved, as people have before me today have mentioned. One of the things I also like to point out is we haven't seen a major changes in how we address mental health since 1987. almost 40 years ago with the introduction of Prozac. That medication changed how we treat mental health. There's many other SSRIs that have come out after that, but that's really the last major change that we have seen. So when we start talking about these medicines and psychedelics in particular, it is complete deviation from what we have for standard treatment out there. The psychedelic assisted treatments work. It's not just the medication, it's that interaction, it's the therapy piece that's going on. The therapy is enhanced and deepened by the medication, and it allows things to come up that might not, or that have been suppressed. And with that, we see transformation. While looking at this and looking at these transformations and what can change, I'm not going to really be focusing on that in this discussion because I'm going to be talking about microdosing, which is completely different. But to kind of give us a prep to start with that, I want to give you a little oversight here of a couple of the main neurotransmitters that we have within our brain. With those neurotransmitters, we have the serotonin, norepinephrine, and dopamine. So with serotonin, what we have found is by increasing serotonin, we see changes in mood, cognition, learning, sex drive, anxiety, appetite, sleep, memory. And by having those by how those are affected, we can have changing someone completely if it's the standard treatment of like SSRIs. The other neurotransmitters, norepinephrine, has to do with alertness, arousal, memory, attention. It affects anxiety and restlessness. And then there's dopamine. Dopamine is responsible for the motivation, rewards, mobility, concentration. Dopamine is responsible for those exciting things like sex, drugs, rock and roll, things that are exciting to us that kind of get our attention and keep us going. For talking about this particular, when it comes to microdosing, what we're really looking at specifically is the serotonin. So what is microdosing? Microdosing is the act of taking 1/20th to 1/10th of a full dose of psychedelic medicine. So if I had a screen here, I would end up showing this graph I have. We're looking at typical high dose psilocybin trip would be about 2.4 grams to about 3.5 grams, often referred to as an eighth of mushrooms. So as a microdose, what we're often seeing is a dose between 0.1 and 0.4 milligrams. So it's a tiny, tiny, tiny amount that we're looking at. When we look at LSD, typically a standard dose, what someone would be seeing, like a tab of LSD, is usually ballpark around 100 grams. So when we're talking about micrograms, when we look at that we're talking about 7 to 13 micrograms. Tiny, tiny, tiny amount. So why do people microdose? Really, it comes down to broadly 3 different categories: better performance, relieving a pathological condition, or be able to stop pharmaceutical medications or other drug use. So better performance, increased creativity, focus, opening one's mind to ways of seeing things in a different manner, or finding creative ways to problem solve. Relieving pathological conditions such as depression, anxiety, pain reduction, migraines, decreasing substance use, and improving symptoms of ADHD. And the last one I mentioned is stopping pharmaceuticals or other medications. I'm not condoning anyone stopping their medication on their own. I do encourage people to talk to their professional provider that they're working with to help guide them through that. Because if someone stops their medication, we can see some horrible side effects such as increased depression, anxiety, increased suicidal thoughts, things like that. So it really should be done in conjunction with them. But with stopping pharmaceuticals, many have found that using microdosing in conjunction with their standard medication, they can start to wean off of those medications, or someone can stop their substance use if that's alcohol or other illegal substances that they're ingesting. And in doing that, microdosing can help by having less side effects. It can be more tolerable to come off of those medicines. So some potential benefits with microdosing: people have reporting increased positive mood, having a decreased negative mood, improvements in relationships with others, feeling that more connectedness that I mentioned earlier in my talk, and having improved cognitive effects. Some have reported that in between by taking these and having that connection with others, which is kind of, for many, can cause increased symptoms of depression, just feeling alone and being by yourself completely. One study that was been done on microdosing has shown microdosers reported having effectiveness in managing their anxiety, ADHD, and pain. And this is a study with over 3,000 participants. Now, if we realize that 3,000 participants is a large number and far surpasses what the FDA would be looking at for a phase 1 or phase 2 clinical trial. So how does it do those things that I mentioned, those 3 things to improve? When we look at mental health, many mental health symptoms all have very similar symptomology, presentations, and how they manifest. I like to refer to that as canalization. Canalization, we think of a canal. A boat goes through, comes out on the other side. There's just one way that things are going. And oftentimes when having many of these symptoms that I've mentioned for mental health, our mind gets stuck in one way of thinking. We can't think our way out of what we have going on. We can't think of an alternative way to have improvements. We can't see anything. Everything does seem negative. So there's a canal in our thoughts are there. And by introducing these substances, how I mentioned in my talk earlier, with the default mode network and having these different portions of the brain connected differently, this neuroplasticity comes up. It's kind of like an individual anyone that's ever been skiing, and they're skiing down the mountain, and other people have been skiing all day. You're going down, and all of a sudden you get stuck in someone's previous tracks, and you can't get out of them. It's very, very tough. And by having the medicine, it kind of adds new, fresh powder to it, and you can kind of get out of your tracks and see things in different ways and connect in different ways. As I said, many of these symptoms have similar presentation. One of those being that rigid thinking. Rigid thinking comes with depression and anxiety, as I've mentioned. And by changing that, we can change how we look at things and how to kind of not look at things and looking at things in a different manner. So many antidepressant medications, what they do is they work on the serotonin 1A. By that, how they do is they hit that serotonin 1A receptor. Serotonin gets built up over time during and after. It takes about usually somewhere between 4 and 8 weeks before someone sees improvement, because it takes time to get that serotonin built up within the system. And what we see with the increased amount of serotonin from the activation of the 1A, we see reductions in impulsivity, aggression, anxiety, emotional responses. We see enhancements in resilience and patience, which then leads to a decrease in depressive symptoms. Microdosing is completely different. It ends up acting on the serotonin 2A receptor, which is the same receptor with the high dose. But what we see is reductions in rigid thinking and pessimistic thoughts, enhancements in plasticity of thinking things in different ways. Environmental reactivity, we become less reactive or reactive in a different way with the stimulus around us. There's an increase in learning and unlearning of behaviors, and adaptability and change, which result in less depressive symptoms and an increased sense of well-being. So the ends are very similar, it's just different means of going about them. And the other thing that we often see with microdosing is with that action, it's not we aren't waiting for the serotonin to get bolstered up within the brain like with antidepressants. So many people report these changes within the first couple of doses that they may be taking. Other things that we see with microdosing and the activation of that 2A receptor is decrease in neuroinflammation, part of which is that inflammation within the body, which one of the challenges, I guess, when it comes to depression in looking at it is what exactly is going on. We do know that increasing the amount of serotonin within the brain, we do see the decreased
I'm working my way towards my car.
we see the depression going on and things like that, but there's other things that we also don't really realize is how much inflammation affects our mood. Having high markers of inflammation do lead to depression and depressive changes within the body, which makes it tough because it's not readily accessible, not really readily understood. But when we see someone that has a major infection or this inflammation that's going on, many do have the increased depressive symptoms. And part of this also with the serotonin where it's affecting is 90% of the serotonin receptors in the body are within the gut. That's why many times when people are starting medicine like antidepressants, before they feel anything, the first couple weeks of taking the medication can be very tough. And they might have GI upset, nausea, diarrhea, constipation, things like that. And that's a result of activating those serotonin receptors that are in the gut. So with microdosing, we start seeing changes within the gut biome, which lead to decreased inflammation going on. The other thing we see is there's neuroplasticity that's going on. We actually see the connections within the brain that are connecting different portions of the brain that don't typically talk to each other, but we also see dendritic growth. The dendrites are part of the brain that connect our impulses and carry signals and messages. And by microdosing or full dose, that neuroplasticity changes, but also the physiology, like that growth starts connecting, which I think is very exciting because there's some things that I'll talk about in a moment that microdosing can help with. That standard medication, we really don't have any. We don't have any better options for them. So some of the other, I said, with that neuroplasticity and those connections that are going on, I think that we can see some great improvement here in other actual medical conditions. What we've seen with the activation of the 2A receptor, that parts of the brain in the amygdala, it decreases the fear response. We've seen this done in studies with rats and rabbits and other at very low dosages, where actually we start seeing this fear being turned off at the low doses specifically. High dose sessions or a macro dose do not actually show that being turned off as well. So some medical conditions, I think that we can see some major improvements compared to regular treatment are some of the neurodegenerative conditions, that being like Parkinson's, Alzheimer's, multiple sclerosis, ALS, or Lou Gehrig's disease, or chronic traumatic encephalopathy. So traumatic brain injuries, being it from playing contact sports, or someone that may have been in service and from IEDs, things like that, just kind of rattling the brain around a little bit. There's not a real good treatment out there for those types of things. And with that, we see those inflammation markers start going up. Many of the treatments that we have currently for like Alzheimer's, all they do is they start slowing down the progressive nature of the dementia. We don't actually see anything getting improved. So the key is starting these medications early on, and we can start slowing it down before things get worse. Unfortunately, when it comes to actually diagnosing and starting medications. Many don't start until it's actually too late and it doesn't actually reverse anything. So with that, we can start seeing this dendritic connection for different parts of the brain that aren't typically talking to one another and having improvements for these individuals. And I'll tell you a couple stories of some patients that I've talked to who have found microdosing hugely beneficial, which, are just small one person, two people, but I think it's really just kind of shows the multitude of applications, but also, that's just talking to one person. If, many more people, and we did some more studies on microdosing, but there's no one paying for those types of studies, I would dare say it would be a huge improvement for many of them. One of the other things when it comes to microdosing that can see improvements is for pain reduction. I think that it's a novel approach. We're having that anti-inflammatory going on, but also with chronic pain, when individuals have chronic pain, oftentimes we start seeing many mental health conditions coming along with it, such as depression, anxiety. Someone who has chronic back pain might start identifying with that condition that's going on, and in doing so, I can't go and family picnic or going out and being in public around people because of the pain. I won't be able to sit. I won't be able to, and then that just leads to increased symptoms of depression. The other thing that's really nice about when it comes to these types of medications for treatment with pain is it doesn't activate the dopamine response, that reward center I'd mentioned earlier. So people aren't craving it, looking for the next dose, or wanting to go, unlike standard treatments such as opioids that have that reward that's there, and people are always trying to chase that first time that they're taking it. They actually have anti-addiction properties that we've seen with many studies, and there's some studies kind of going on right now at Johns Hopkins looking at using it for nicotine cessation, opioid cessation, and alcohol use disorder. Well, there's actually been a study with pain specifically that they did what's called a ice bath test. And what they found is they took individuals and they had them put their arm into this bucket of ice and see how long that they could hold it. And with that, I think the average time the first time around was about 12 minutes off the top of my head. But what they found was individuals who had microdosed before could last longer submerged in that near freezing ice. And it was an increase of about 20% longer. And these effects lasted at both the 1.5 hours after submerging and 5 hours after dose administration. So these effects can last for much longer. One of the conditions, I do some talk and I do work with an organization called Cluster Busters. Cluster Busters is a citizen nonprofit where individuals who have cluster headaches, also known as suicide headaches, because the pain is unlike any other pain that is out there. Sufferers will tend to have frequent headaches, frequent migraines, and try numerous things such as oxygen therapy. Many will try basically every medication that is out there, and the only thing that ever helps for many of them is being in a quiet room with that photosensitivity, wearing an eye shade and being in the quiet, in the dark, and being isolated, and that can reduce it. But other medications typically don't do much of that, such as Imatrix and things like that. What we do see is with cluster headaches, microdosing does end up having it. Not only does it reduce the pain, but it also decreases the incidence of pain, so people have them less frequently by a dramatic amount. And there's been some really good research on this, and there's a couple of drug companies out there right now that are starting to do some phase 2 clinical trials for FDA approval for microdosing specifically. Other medical conditions looking at that could be improved with this is anorexia. There's been some studies, which is actually one of the most difficult mental health treatments to treat, and also has the highest mortality rate of all mental health conditions. Rheumatoid arthritis, asthma. There's some really good research, a lot of research in the early years, back in the 50s and 60s that I mentioned when studies were kind of rampant for everything. They were looking at, there's quite a few papers on microdosing and full dosing for asthma in the the Journal of Asthmatic Treatment. It's a whole thing, but there was a huge amount of articles that were printed in there specifically. Other treatment options for fibromyalgia, post-treatment Lyme disease. There's some really good research that we're looking at with that, and other things that are associated with inflammation, including depression. So I think with microdosing, I'd mentioned as using it, 30% of individuals who take medications for their mental health have improvements when there is a co-occurring therapy that's going on. And with microdosing, I think it can be specifically really important and really more improvement for many if they're doing it with therapy, because as I've mentioned, what we see with microdosing is many individuals have an increased connection with others and have changed their perception around them, or less concrete, that anti-canalization that I had mentioned. So people can start being more truthful with themselves and truthful with others and talking with their therapist and actually doing some of the work and getting around some of that ingrained entrenchment that is there. Because if we don't do something with it, all we have is just those physical changes that are going on. But if we can start incorporating ways of thinking differently, seeing things differently, and having the therapist or using kind of the journaling section of my book here, we start seeing there's patterns that we can change, and someone calling us out, maybe coming up with new ideas that we might not even think about. I keep throwing around this term microdosing. I gave you an amount. I said, I commonly do refer to the amounts for microdosing specifically with mushrooms, because it's kind of the most popular, because as many know, and there's some talks that are going to be going on about growing and accessing. Anyone can grow mushrooms. They will grow. Nature has a way of doing it. But with that, where would I start? I said, oftentimes we see a dosing being between 0.1 and 0.4 of a gram. But individuals everyone is different, everyone's put together different, and everyone might have a different individual need. One of the things to kind of look at is size of an individual. The larger the person, like myself, I might be at the higher end. Unlike someone who might be like a 100-pound girl who might not need that much. With that, we also kind of want to take into consideration that with microdosing, the side effects are often dose dependent. So if someone is having some of the side effects I'll talk about, by reducing the dose down, they might be able to tolerate it better and have better outcomes. So some people will take their microdose when they find out what their dosing needs are. They might grind them up, put them through a coffee grinder. I recommend not doing that. Trader Joe's or somewhere else, I think they frown upon people bringing in their mushrooms to put through their coffee grinder. I've never challenged this. I'm just assuming. But if you put them through a coffee grinder, you can end up going and you can get something off of online that's a capsule making kit. So you can make your own capsules, so you can have them all pre-measured out. They look just like other medications or other herbal supplements, so they kind of fly under the radar if someone was to ask you what they are. The other thing as I was saying, 0.4, 0.1, these amounts. You can go online. There's a company called Amazon that has these things called there's a scale. What I recommend is not getting a standard scale, because most of the times these little scales will measure in full grams. Apparently there's other substances that people can procure, substances that may be legal or not legal, that go by grams. So they won't measure the small amount that is a microgram. So with that, if you look for a jewelry scale, they run about $20. You can get those tiny, tiny amounts that are there.
Question.
Yes.
Yeah. Do you have like a sort of length of time that somebody shouldn't exceed?
You're about 2 minutes ahead of me, Kim.
Sorry.
Yep.
Hey, that was my question. You wait your turn.
So, I also want to kind of roll back here for a moment where I said, with journaling, I think that is really important as we start looking at microdosing, and I'll explain that with it as well, because I think that is the part where really we can kind of see some improvement here. So some of the things to kind of take into consideration when finding a personal dose. What is someone's caffeine intake or coffee intake with it? Some of these substances, as I've mentioned, can be stimulating, in fact. So if someone is taking coffee with that, they tend to have a synergistic effect where 1 + 1 = 3 and not 2. While I take into consideration food, drink, things like that. Because if someone is microdosing, they found what their adequate dose is for them, and they always take it in the morning with breakfast, and then all of a sudden on a day they don't eat their breakfast and they start microdosing with that, and now they have GI upset or something, it might be the factor of not eating with it. One of the other side effects that someone has with nausea that is common with it, some people will add with like some mint tea. They might end up putting some lemon with it, which is called a lemon tech. Things like that. Most of the time, probably 99% of the people I talk to that do microdose, what they find is it can have a stimulating effect, so many people will take it in the morning to start their day. I've had 1 or 2 people I've talked to that have had where microdosing actually makes them feel tired. And with that, I encourage them to take it at bedtime, but most people, it will not, most people taking it at night actually might keep them awake, so that's something to consider. There's many ways of going about it. There's a couple of different protocols for finding a microdose and taking it. The most common that I'm kind of partial with is called the Fadiman protocol, which consists of taking it on day 1, taking your microdose, taking it, looking at some of the journal factors that I'm going to talk about. On day 2, that kind of has a honeymoon period where, they might not feel as great as they did as on the microdosing day, but it kind of readjusts the body and kind of know what's going on. On day 3, I encourage people to not dose again. This is going to be the worst out of the week, out of the days. It kind of gives the body a time to reset a little bit, but also kind of takes us to look at what is our body doing without taking the microdose. What do we feel like? And we know that the day is cruddy as it is, the next day we're going to dose again and restart the cycle. With doing that, that 3 on, 1 on, 3 off, and dosing like that, if we look at some of the journaling prompts, some of the things I kind of have people I encourage people to look at is, what is their emotions like? What is their mood like? What is their anxiety levels at? What is their senses? How are they noting the world around them? They're smelling, they're tasting, they're touching, that connection that's there. How is your concentration? Is your concentration better? Is it worse? Is your anxiety better? Is it worse? How am I feeling connected with others? Am I feeling more social or not? But also looking at physical effects. Am I having a physical discomfort somewhere? Am I having GI upset? Am I having physical pain better or worse? Things like that. Commonly, in my everyday practice, I might say to a patient, how has your mood been lately? How are you doing? And typically someone will say, well, it's been good or it's been bad, and they can kind of partially remember, one day in particular it wasn't good or it was really good out of the last 6, 8, 12 weeks that I saw them, because we kind of get notice what is there in the immediate. We don't kind of take stock into what's going on every day around us. And it's kind of tough to the mood gets lost in the weeds a little bit in the trees. So we kind of go and look at some of these journal prompts and looking at how we're doing, we might get a better idea of how am I really doing, kind of that mindfulness practice that's there. Other protocols that people will have is the Stamets stack, where it's kind of a Monday through Friday. 5 days on, 2 off. Oftentimes people do it like during the week that they're working on those days, Monday through Friday, and then take the weekend off to do a reset. I'm not as partial to that. If someone wants to do that, that's great, good for you. I find though with the Fadiman of the 1 day on, 2 off, and then redosing, you kind of get more of a relationship with the medicine as opposed to having a kind of that standard medication feel of here's my medicine, I'm going to take it today, and you kind of build more of a relationship. But you also, if you're doing the journaling, kind of looking at what's going on and your authentic self, you kind of might feel I need to go up, I need to go down, and with that has that connection and that connection with the medicine specifically. I typically recommend that people will microdose for 4, 6, 8 weeks or so, building until they find what their dose is, and during that time working with it. I recommend at the end of that time period, take about a month or 2 off. One of the proposed side effects from microdosing that we see, I'd mentioned the serotonin 1A and the serotonin 2A receptor. There's another serotonin receptor that's arguably affected. It's the serotonin 2B receptor. That serotonin 2B receptor, when it chronically activating that, can lead to cardiac conditions, a thickening of the lining of the valves in the heart. There's no research on medications such as psychedelics doing this. It is kind of a proposed thing at this point. There's been no studies with it, and I think that's going to be the challenge with as we start looking at microdosing specifically, potentially being FDA approved, is no one wants to induce this in individuals. There was a study that was conducted in the early 60s with chronically dosing children with schizophrenia with about 100 milligrams of LSD daily for about 6 weeks. And with that, they did find that thickening of the lining. So it is kind of hypothetical. There's some medications that have been FDA approved and have been pulled from the shelves that are chronic migraine headache medication, the medication that was available in the early 90s called Fen-Phen that had this cardiac condition. It was a weight loss pill. And what happened is it would start thickening up the lining of the heart. So it is kind of proposed. My argument, there's a pharmacist that's kind of really come up and talking about it and kind of pushing toward, I don't want to say fear, but making people aware of it. And kind of my argument is we haven't seen it yet. It's kind of hypothetical, and there's thousands of people who have microdosed. We haven't seen it, but also in this wonderful time of the 60s, 70s, and moving forward, there was lots of people who were going on tour with like the Grateful Dead, dosing very often at high doses, and we've never seen any of the cardiac conditions with people who were going on tour either. So I really think it is kind of a hypothetical at this point, and I really hope that we can get that research understood a little bit better. So kind of the big thing when we're looking at finding the personal dose, as the words go with cannabis, start low, go slow. Looking at the effects that are going on, some of the side effects that people have are dose dependent. So if they start having them at like a 0.3 or 0.4, they might need to be at a lower dose. So that's where, you just kind of ride out your time in a couple more days, just trying it again at a lower dose and seeing where we're at. But we need to remember when we're talking about microdosing, it is a sub-perceptual. If someone is taking the medicine and going and on their way to work, because as sub-perceptual, theoretically, you should be able to go to work. If you're going to work and now your boss is a dragon standing at the end of the hallway and you're having to be afraid of the dragon that's there, that is unfortunately not a microdose. I definitely recommend reevaluating your dose and maybe even talking about where you accessed it, because it really is different. The other thing to kind of consider with this is if someone is growing their own or procuring from somewhere, the amounts can change. I believe Lenny is going to be up talking here soon about growing mushrooms, hypothetically.
Gourmet mushrooms. We're going to talk about gourmet mushrooms.
Yes, gourmet mushrooms.
Yes.
So as someone is using these substances, the amount of medicine within the mushrooms can change from strain to strain, but it also can change from one grow to another, and also it can change from one flush to another. I know that these are some terms you probably don't know right now. When Lenny is up here, he will explain what that means. But as you're growing these different amounts, also, if you look at a mushroom, there's the cap and there's the stem. There's more within the stem. There's more of the medicine in that compared to the cap, which is why many people will end up going and grinding them up, and so you get a uniformity throughout there as you're taking it that's similar every time. So if someone was to access, buy a bunch of mushrooms that were from someone, and they go and they use up all of theirs, they go buy more, I would encourage them to go and re-challenge their dosing in doing that and figuring out what their individual needs are, because it can change the strength, which could change their experience. There are some possible things to kind of be aware of. There's some medication considerations that are there. I will say I'm not giving any medical advice. You are not my patient, but things to consider that I encourage you, if you are doing this, to talk to your healthcare provider about. One of the medications is lithium. Lithium with high dose is absolutely a no-go. It can increase the seizure risk. At low doses, I don't encourage it. There might be some other options that might be there that you might want to do. When it comes to medications such as antidepressants, the SSRIs or SNRIs, I kind of mentioned at the beginning, in doing them in conjunction. Some antidepressants, there's some people have reported with high dose having diminished effects from microdosing or macrodosing if they're on those types of medications. So hypothetically, with microdosing, that could be the case as well. So sometimes, I did say that 0.4 is the max. Some people might, to stay in that subperceptual, they might end up going a little bit higher if they're on these medications. I would not encourage someone to just assume that is the case, or that you have a high tolerance, or you are special in any way for how you take medicines. I would still say start low, go slow as you're starting to see it, but it can block some of the effects. Sometimes other medications, such as antipsychotic medications, and I'm not encouraging someone who may be psychotic to microdose, but sometimes antipsychotic medications are prescribed for adjunct therapy for depression. I do prescribe some medications like that oftentimes. So those types of medications can block and hinder some of the effects. Also with that, if someone is on psychostimulant medications such as methylphenidate, Ritalin, Adderall, Vyvanse, things like that, as I said, they are all medications that can be stimulating. Just like caffeine at the beginning, they can have a synergistic effect. So 1 + 1 = 3. So you might not need to dose as high. And some people even might forego their medications for ADHD or the psychostimulants as their microdose, because they might not need it as much, because it does help with those types of symptoms. Other complications to consider, is that cardiac part that I had mentioned before. With microdosing, if someone does have a history of psychosis, we don't know exactly how that looks for people when it comes to looking at treatment for using psychedelic substances. Individuals with a history of psychosis or a first-degree relative are often left out of that clinical research. We're starting to see that kind of change up a little bit. My fear is, and I'll answer it because it's typically a question I get, is I have bipolar, can I microdose? The answer is you're free to do whatever you want. But hypothetically, I do have some concerns where people might end up becoming manic in that state from it. We see this very commonly with standard antidepressant medications. So I do encourage people to buddy up with someone, a loved one or someone that knows them, because as someone becomes more manic, we are not the best judge in what's going on with ourselves. And sometimes it's helpful to have someone else point out, your mood's a little bit too good. We might want to kind of look at that. Kind of the biggest side effect that I do want to mention for people when we're looking at microdosing is the side effect of incarceration. These are substances that are federally and state illegal. There are places that they are decriminalized, But I will tell you, I ended up 2 years ago, I ended up testifying for a nurse that was microdosing in Indiana. She was arrested for her grow operation that she had. In doing that, because of the amount that she had, they had charged her with felony amounts because of the large amount that she had. Not anticipating, it turned into a whole legal battle for her. She lost her nursing license and really affected her kids that she had and her ability to see them because she was incarcerated during that time. Part of what I had said when I had testified before her in court was, here's this individual, she had X number of grams, I don't remember off the top of my head, but the amount that she had was technically, according to the state, being a felony amount. But it was no different than how I prescribe standard antidepressants of, take one, take two, and then do 90 tablets at a time with 3 refills being a year's amount. And that would kind of worked in her favor that the amount that she had was for personal use, and they were able to work down with that. I want to just mention a couple of quick stories here for individuals that have seen improvement. There was one individual who came up to me at the first year of the Fungi Fest, which would have been over 3 years ago. When they came up to me, this woman was telling me about her husband, and I got to meet him as well. He had developed a stroke on the left side, so the right side of his body, he lost all use. He was not able to walk or use his right arm. And he followed his standard treatment, went with his medical providers, did the PT and the OT and the standard meds. And what they said was, at the end of the year, after 1 year of doing treatment, this is the best you are ever probably going to get. You still continue to do treatments so things don't get worse, but chances are you're not going to get much better. Her and her husband did not like that answer, so they went online and procured microdosing chocolates, and within 2 weeks he started regaining the use of his right side and was able to, he was there and he was walking, and people will say that microdosing is not something that actually works, but for him it absolutely was. There was another individual I was talking to that their aunt was diagnosed with dementia. They had sold all of his belongings, and she was getting ready to move into a nursing home within a couple of weeks. They were all set to go and kind of figured that was the end of her life and going through the grieving process. And she started microdosing. And last time I heard, she was backpacking across Europe by herself.
Cool.
These are just a testimonial of one patient or one person that was doing it. But I think that there's something here that's huge, and these are just a couple of people who are different walks of life that have had different conditions and had major improvements. So really with microdosing, there's a low risk with a potential high reward for many people if they're doing it safely and smartly. So I really encourage people to, keep that as an idea and as an option. And I'm really hopeful that we're going to see this improve further. Anyone have any questions?
You're too good.
Thank you. I've done this a time or two, so I usually anticipate them. Thank you.
Thank you very much.